2, 1.
Hi, good afternoon, everyone. I hope you are all doing okay on this lovely sunny day. So we've got 30 minutes with you today, perhaps just a little bit less than that. And with me today, I have got Matt Tucker, who is our Silver Lead. I've got Cindy, Lead Nurse for Infection Prevention, Dr. Natarajan, Manjula, who's our Director of Infection Prevention, and Corrine McCullough, who is, as you know, our lead nurse, is part of the swabbing team. Thank you very much to our comms team and to Matt Brown as well for being here to support today and getting everything ready for us. So as usual, can I just remind everybody, if you want to ask a question, this is how you do so. I think everybody probably knows by now, but it is just a good reminder. And equally, if you want to add any subtitles, there's just a reminder there of how you do that. I have forgot somebody actually. We've also got Faye Gordon with us today. Faye's been on leave for a couple of weeks. Very well deserved, well earned couple of weeks leave. So she's just sitting in today because she's going to be taking over from Matt next week. So this is the agenda for today. We'll go through the normal COVID-19 figures with you, what the forecast looks like. So that's that lovely graph with lots of data points on it, a little bit about vaccination, and then something around health and wellbeing and support for our colleagues. And then there'll be time for questions at the end. So please do ask us any questions if you've got anything that that is bothering you or you want to know about. So I think at this point, Matt, I'm handing over to you.
Thank you, Debbie. Yeah, so I'm Matt Tucker. I'm the Deputy Chief Operating Officer, and talk to you about the numbers of patients we currently have in the hospital and what that trend is like. So if you remember from last week, we had seen a general trend of a reduction in the number of patients we have on site with COVID. Over the last few days, though, we have seen that start to increase, with today, although it was reported in the original comms that went out first thing from the trust as 24 patients with 1 ITU, we have confirmed that actually we have 23 patients, and that 1 patient in ITU is not a reportable COVID patient. They have previously probably had a COVID infection, but of a very low viral load, which means it's not reportable, although they are being treated for symptoms of COVID, but they're not reportable. So currently we officially have 23 patients, which is an increase on what we had at the end of last week. Not, I would say, as a trend that we can say is definitely upwards all the time, but it is an increase on where we have seen. But hopefully, and if we go on to the next slide, please, we can see the forecast, which won't go through the details of the graph because we've been through it the last couple of weeks, but it just shows you the right-hand side of the graph where we are forecasting our best, worst, and most likely, with the little blue line in the kind of sea of blue being the likely forecast position of where we're seeing beds demand, and that's showing a decrease over the month of later this month and into September. So we are predicting that we're going to see a reduction in our COVID demand coming onto this site. Now, currently, the patients we have are still mainly clustered onto Harroden C, which we are managing most of our patients on there. We still have our outbreak on Barnwell B, which luckily we have had no, or not luck actually, from all the really good practice that staff and all our infection colleagues are supporting them with. We haven't had any further positive patients on Barnwell B, and if that continues to the end of this weekend, we will be able to declare Barnwell B a non-outbreak ward, which will be really positive, and reopen that for general admissions. So we have 5 patients still on there. We have 2 patients in our delivery suite at the moment, and that makes up all our patients. So delivery suite, Harroden's, and Barnwell B are where our patients are. Interestingly, just going through the details of what type of patients have COVID, when we looked at Wednesday, of the patients we know their vaccination status, of which 20 we knew their vaccination status, 11 had been double jabbed, and therefore 9 hadn't. and 8 are under 55. So we're still seeing a pattern where it is mainly proportionally higher in our patients who are unvaccinated, but it is definitely not exclusive to that. I think that's my update around the COVID status and what's happening in the organisation. Thank you, Debbie.
Thanks, Matt. So a couple of points there, I think. The first one is we've clearly got some ladies in hospital who are pregnant and have now got COVID. So just a reminder really that if you are pregnant and you've not had your vaccination, please do go and get it. And also, if you know people who are expecting a baby, then please do advise them also to get a vaccination if they haven't. As I've said before, this virus does not discriminate. So if you haven't had your vaccine, please do go and get that. You can book online. The details are at the bottom of the screen. And you can also walk into the vaccination centre, which is based at Moulton Park. It's open 7 days a week. It's really quite quiet at the moment, so there's no waiting time. You're almost straight in and straight out. One of the questions that I think was asked at the group briefing last week was, will the vaccination centre be doing the under 18s? And the answer to that is no, they won't. That is most likely to be via GPs, but there are no plans at the minute for the vac centre to be doing under 18s. Losing my voice today, sorry. Could we have the next slide, please? I think also from the stuff that you were just showing, the info you were just showing, Matt, our numbers of COVID inpatients have remained fairly stable, but have fluctuated between 18 and 25 over the last week. So we have dropped to around about 18 at best case, and then it's gone up again 23, 24. So we're not seeing a rapid decrease as perhaps we would expect to see. And I know that we've obviously had an outbreak which will have affected our numbers going back a couple of weeks, but I would expect to now start to see those numbers coming down unless we get another outbreak. So what that means is we don't want an outbreak. I think that's a really strong message today. We don't want to be bringing this virus into the organisation from outside. So it's a reminder to all of our colleagues to please make sure that you are careful when you are outside of the organisation. We've heard nationally about staff going out to parties and one person perhaps being positive and not knowing that they're positive. And that's obviously caused issues locally and nationally. So just a word of warning really, please. We've all got a duty to care, and that's while you're at work and also while you're outside of work. So in terms of support for colleagues, local and national support, as you can see on the screen. So we've still got the KGH support, the We Care Cafe, the open office is still there, and that will still be in place for the next 12 months. Then we've got support through the whole of the county around Changing Minds, the IAP team, Stronger Together, and that the information for that to access is on the screen. And then of course there's the national support, the national numbers that you can call if you don't want to or don't feel that you can access that support locally. That support is there, will remain there, because of course I think everybody at some point has been affected by the pandemic. And what's really interesting is that it's not the effect that the pandemic has had on us is not linear here. So we will all feel different at very different times. So it's really important that not only as a trust, but as a county and nationally, we keep this support in place over the coming months. Thank you. Can we have the next slide, please? Okay, so I think we are now on questions. So thanks, John. So John in the Q&A has added in where you can book your COVID vaccine. So there's a link there you can just click straight on. So please do have your vaccine if you've not had it. But as I say, this virus, it does not discriminate. How many patients are in the trust being treated primarily for COVID? I think you mentioned that, Matt, but perhaps not in so many details. So I'll probably just come to Cindy if that's okay for that one.
Hi, sorry, yes. So I would say at the moment there would be 22 of those patients that we have in currently are being treated for COVID-like symptoms.
Thank you. I'm going to stay with you for a moment, Cindy. So if we're pregnant, should we avoid face-to-face contact with patients if we can work virtually?
I don't know whether that's a question mainly for Corrine. For me, I think if you are adhering to all your precautions, you're wearing your gloves, you're wearing your apron, you're wearing your mask, and you're vaccinated, you're doing all that you can to reduce the risks. Obviously, you'll have, as part of being pregnant, your workplace risk assessments, and that should be something that is discussed during that process. And I think also it will be determined with the nature of the job that you do.
Yeah, thanks, Cindy. And that's probably a good point for me to say that agile working is still in place and will continue. So we are still encouraging you to work from home on occasions, unless you want to be in the organisation. I know that many of the services and departments have got their own local rules in place now. So for instance, the executive team, some of us are working from home 1 day a week, others a little bit more, 2 days a week, but certainly no more than 2 days a week. And there's some of us that are not working at home at all. So I know that that's service specific and department specific, but just to let you know that we still have that agile working policy in place in the organisation. What is the percentage of vaccine uptake among hospital staff? I believe that that's 90%. I don't have the breakdown in front of me, but Cindy, do you have any more detail of that?
No, I think that would have come through to Corrine. So I think that sounds about a reasonable reflection on our staff vaccination rates.
Yeah, thank you. Thanks, Cheryl, for your comment here. Do you have any clarification of whether 17-year-olds will have 2 vaccinations? GP has only advised 1 at the moment, which is booked shortly. Good to know that you're booked in. I'll come to you, Manjula. Thank you.
I did hear in the news, Cheryl, that what they are doing is doing the first vaccine, getting the data together to determine what the gap should be. So they will be notified via the GP whether they need the second vaccine, and if so, what the gap between the 2 doses should be.
Okay, thank you. Probably come next to Cindy, I think, but it's a general comment for everybody, actually. I know staff should change out of uniform when travelling home, but what are the rules for staff who smoke on Rothwell Road in uniform? Not a good look. Not a good IPC way of working, really, is it, if somebody's smoking in their uniform? But Cindy, over to you.
So from a uniform policy, it is very clear. We would advocate that staff change before they go home out of their uniform before they leave site. Obviously, the site is a non-smoking site, so therefore any staff should not be smoking on site. From a reputation and also perception issue, I also think that it's not a good look for people to be standing off site smoking. I would suggest if that's what they have to do, they would change out of uniform, because obviously, you know, you've got the general public walking by and it's not a very professional image to present from as an organisational perspective, and obviously from an IPC perspective equally.
Yeah, thank you. Thanks for that. So will staff be required to have a 3rd booster vaccination? Manjula, can I come to you for this one, please?
Yeah, sure. Again, the Joint Committee on Vaccination and Immunization, the acronym we all hear every day, JCVI group, have got together and they are deciding who, when, and how we can get the booster. And my understanding so far is it will be perhaps the healthcare workers, but equally those who would have been eligible for the flu jab. So the over 65s, the vulnerable, the immune suppressed patients. But that list will be announced probably, I would expect, well before the end of September, so that everybody can get ready with the logistics of ordering the vaccine. That's as far as I know, I'm afraid.
Thanks, Manjula. I'm going to stay with you, I think, for the next couple of questions. So when is the flu jab going to start in KGH, and what is the policy with the COVID vaccinated people?
Ooh, that is something perhaps I don't know whether Corrine would know, but that is something for Oki Health. Normally, if I remember my own experience, the flu jab would start about September, October time. And that's when we should be starting the flu jab. But I think there will be a slight delay so that we can find out if we are going to get a booster, can we make this one visit rather than 2 different visits for people? So it's easier. Also, logistics of ordering, storing the different types of vaccine, all that will go into play. I'm pretty sure once we know the details, there will be general comms to all of us in the near future. I'm hoping probably by mid-September, if I'm not mistaken.
Yeah, thank you. Corrine, is there anything you wanted to add in there, or has Manjula covered that?
No, most of it's covered. So the plan is the flu jabs to be started in September. At present, they are trying to marry the COVID vaccine booster and the flu jabs together, but it's not finalised as yet. So again, we wait until the proper guidance has come out.
Okay, thank you. So there's a question here. Is there any time frame for when the guidance in regards to the changes in policy of masks for members of staff who wear sunflower lanyards mentioned in the listening event yesterday is going to be communicated? Who can I come to for that? I think, Matt, can I come across to you? Because I know this is something that you've been working on with Silver.
Yes, of course, Debbie. So yesterday we finally ratified at Silver and Gold that policy, or our standard operating procedure to support kind of a certain cohorts of staff who have got medical exemptions to allow them not to wear masks, and that will be communicated out. We are just going to wait to officially do that, just in case in the next day Public Health England do issue guidance in relation to any changes, just to make sure that we're not issuing something and then having to change it within the next day. But that will be coming out imminently this week unless there are changes in the national guidance.
Yeah, thanks, Matt. And I think it would be remiss of me at the moment to mention wearing masks in offices. So we've talked about this for the last couple of COVID briefings. And the NHS rule at the moment is that masks should continue to be worn in office spaces, in meeting rooms, within an NHS building. So my sincere apologies for giving you the wrong information. It was not something that I made up. It was information that I had also been given. So that is our policy as it stands currently. And again, if that changes, we will absolutely come out to you. But that's not local policy, that is national NHS policy. And I have checked with colleagues across the NHS to see whether or not they are doing anything different. There's a slight mixture, but the majority are sticking with the overarching NHS rule. Have we got any more questions? One more. Some office staff members are required to go onto wards. Should we be supplied with scrubs to change into prior to going onto the ward? If so, can these be handed out to the offices, or do they need to be picked up elsewhere? Cindy, that's a really good question and not one that's come up before. So really good point. Thank you for raising that, whoever has raised that. Cindy.
So when I suppose it has to be assessed based upon what that individual is doing, i.e. are they just walking on the ward to deliver something to the reception, or are they then going on to be engaged in any clinical activity? If it is just that you're delivering something to the front of the ward, then I don't think there currently is a requirement, both in either guidance or process, that you need to go into scrubs. If you are, for example, you come into the entrance of the ward, you would wash and decontaminate your hands, deliver what you're delivering, turn around, wash your hands again and leave. I think it may well have to be assessed on a case-by-case basis, dependent upon the role that individual is undertaking in relationship to the clinical area.
Thanks, Cindy. So combining flu vaccination and COVID vaccination for people who have had a reaction, would they be separate jabs? So if wanted, they can have them separately. I've actually just got some information through from Paula, who's our HR director. So the flu jabs are likely to be late September or early October. That's the first one. And the COVID jab has to be 6 months apart from the last COVID jab. So we've got a slightly added complication in there. I couldn't get my words out then. Added complication with regards to COVID. So it looks like they may well be separate jabs from what Paula is saying. But as we get more information on that, we'll absolutely let you know. Any other questions from anybody? We've had, I think, Matthew, at most about 110 people join us today, which is great to say it's holiday season. So thank you to everybody for joining us. Is there anything else, Matt, Cindy, Manjula, Corrine, Faye, that you'd like to raise?
No, thank you, Debbie.
Nope. Okay.
Yes.
Oh, Corrine does want to come in. Lateral flow tests. You've just reminded me, but do you want to go ahead, Corrine?
Okay, thanks, Debbie. Yes, just a brief reminder to all staff. If we appreciate the staff are using their lateral flow twice a week, and we will absolutely encourage that. But if anybody has any symptoms, no matter how mild at all, we would request that they actually come for a PCR and not to use the lateral flow if they have symptoms. Just come have a swab. If your swab's negative, you go back onto your lateral flows, and then we will give you further guidance if it's not. Thank you.
Okay, great stuff. Thank you. I can't see any other questions coming in, but if anybody does have another question that you want to ask, please do either drop one of us an email, give us a call, or if you still put it in the chat, we've got access to that, so we'll be able to answer it via the chat. So thanks everybody, thanks to the panel, thanks to everybody who's joined today, and to Matt, John and Liz for their support on today's session. Lovely. Have a good rest of the afternoon, everyone. Thanks. Bye.